I love the community health center model because I get to see the entire family. I get to see grandma all the way down to a newborn baby.
This is a social gathering place, not just a doctor's office.
It's very good, and there's a lot of people that use it, and I think they would be in trouble if they didn't have it.
They make you think that you're very important, and that's something that doesn't happen when you get to the big ones.
You get to perform a service that they can't receive any other way, and it's very satisfying.
You know, I think we found it something that was extremely needed here, and it's evolved, it's grown year after year after year.
To see the growth and to see how fabulous our facilities have become and how that we've been recognized as being, you know, one of the pillars in the community.
It all began back in 1982 when the railroad rented out a small building for $1 a year to a group of citizens who wanted to bring quality health care to the community. And so began the Glens Ferry Health Center, which in 1984 opened a satellite clinic in Grandview, and a larger facility in Mountain Home later in '98. In 1989, GFHC bought the local Mormon church in Glens Ferry and converted it into what is now headquarters for the three-center network.
We've grown from 10 employees to 40 employees, and also grew in one more community, which is the largest community of our three sites. And we see a lot of people there that weren't getting the care that they needed before we moved to Mountain Home.
They're thankful for even just the basic care that they can receive, and they're so thankful that they don't have to drive 100 miles to receive care, that they can get that in their own backyard.
And we have X-ray on site in 2 of the larger health centers.
Take a deep breath in and hold it.
And lab work and all the different things that we can do. It's kind of amazing that some still, when they're the first time visit, they didn't realize, like, oh my gosh, you have dentists too? And then they're just like so excited. Well, now I know I can come here for my dental needs. And then the behavioral health, to know that they can come in. And so we get lots of referrals from the schools that need some children tested and to see where they are and working in their behaviors and different things. Suicide is pretty high in the state of Idaho, and we really have been able to work with some teenagers that have made a difference in that particular part of their life too.
I can remember back over the years several different times when people were actually on the verge of death and didn't realize it, and because of just things like our health fair. They found out that they were, and they were taken care of and moved on.
We have caught many serious conditions that have saved many lives.
Okay, let me take a listen. They have one place where they get to go to and get everything taken care of. They're not going to 6 or 7 different doctors. We take care of the whole person, behavioral health, mental health, dental, the whole deal. And we collaborate with each other, which helps our patients.
It's good clinic, it's good people, and I'm happy for everybody for a long time.
Valley Healthcare, this is Kathy. Can I help you?
Well, it's so nice because all I have to do is call up Kathy and say, I've got an ache or a pain, and she works me in. And you can't do that with a large hospital. In fact, and they're so caring. It seems to me that the doctors they have here are so caring, and the nurses are so caring.
I know there's a lot of people, and us also, that if the clinic wasn't here, we would not get proper treatment until we had to go to an emergency facility that ends up being a lot more expensive.
The difference is we take all comers regardless, if they can pay or not.
We have a sliding fee here where Joe Blow can't afford anything. He comes in and he's way down here on the sliding fee. It's not going to cost him much to get in here, but he still gets good primary care.
We're seeing people that are not normally folks you'd in the past have expected to see use our services. We're seeing people in all age groups, both sexes, people that would have been retired and secure in their retirement.
In the corporate world, it's about profit first. In the community health center, it's about the mission first. Granted, no money, no mission, but it is about the mission first. And so it's very different in that aspect, and the pressure is different. But the pressure is to do good things and not to do things where you cut corners to gain the profit and give it to something else.
Our success is made possible by the providers who take such great care of our patients, and by our leaders, including a 10-member board of directors that is a true reflection of the community itself, with retired school teachers, a retired college administrator, a sports journalist, a police chief, and ranchers.
Or pinch, pinch. Okay.
It's a beautiful thing to see people come in that would not be otherwise taken care of. And we're very proud of that. We're proud of our facilities, the fact that we've kept up with the needs in the community.
People appreciate you. You're a, what should I say, a big cog in a bigger field here than you would be anywhere else. And I think that's the name of the game if you went into medicine for what I did, to take care of people.
It's a family setting, and we care about our patients and care about each other, and that makes it a great place to work.
Being able to spend time with my patients and help them to become better people and to live a healthier life was the reason I got into medicine, and this model of healthcare gives me the opportunity to do that.
Yeah, I think our legacy is just that we've provided good, sound health care to the whole community. And it didn't matter whether you had money or didn't have money. You got your health care.